I'm Dr. Darren Cabo McCauley, DO, founder and Chief Executive Officer of Concierge Medical Cannabis. Today, we're going to be talking about cannabis side effects and adverse outcomes, because less risk does not mean no risk at all. Cannabis is broadly safe and the safety profile has been well established over years. However, cannabis does come with known short-term and long-term effects if used on a regular basis. Understanding proper dosing, routes of administration, and personal history can help guide patients and practitioners to avoid unsafe usage. Minor side effects from cannabis administration are relatively common. Non-serious adverse effects touch all of the main systems that cannabis does. Dizziness is the most common non-serious adverse effect, followed by gastrointestinal distress, sedation, lethargy, blurry vision, and short-term memory lapse. Meta-analysis, or looking at many different trials together, is limited because the effects and side effects of cannabis depend in large part on the dose and the route of administration. Routes of administration and dosing are often not held as a standard during a meta-analysis. Despite its safety profile, serious adverse events can be associated with cannabis use in both the short term and the long term. These include the following, which we'll be discussing today: respiratory effects, cardiac effects, psychiatric effects, hyperemesis or nausea and vomiting, addiction potential, and social implications of widespread cannabis use. When smoked, cannabis has 4 times more tar and carbon monoxide than a tobacco cigarette. Studies are inconclusive as to whether or not marijuana smoking leads to the exact same pulmonary complications as smoking tobacco, although it has been shown in some studies to lead to chronic obstructive pulmonary disease. Frequent cannabis smokers may have the same effects of lung irritation, including chronic cough, decreased exercise tolerance, and increase in propensity for both bronchitis and lung infections. The dose-dependent effects of cannabis on the cardiovascular system may contribute to both stroke and cardiac disease. THC in particular stimulates the sympathetic nervous system, leading to vasodilation or the expansion of blood vessels, particularly in the brain, the cerebral vasculature. This can lead to an increase in stroke and an increase in falls when changing positions. Increasing sympathetic tone also leads to an increase in heart rate, increased blood pressure, and cardiac arrhythmias, which can raise the chances of heart attack and cardiomyopathy, or heart muscle dysfunction. THC has a direct effect on platelets that facilitates thrombus or clot formation, and a hypercoagulable state which can facilitate both strokes and heart attacks. There have been multiple case reports and retrospective studies that suggest a link between cannabis use and heart attack. However, there have also been other studies that show no correlation at all. Heart attack after cannabis can occur within the first hour, or it can also occur within a 5-hour window of use. The exact cause of this phenomenon is complicated by subsequent cardiac studies that demonstrate arteries with little or no plaque, suggesting vasospasm as the principal cause. Although cannabis use has anecdotally been associated with heart attacks, the incidence is still exceedingly rare because the number of heart attacks in young people with no risk factors is in itself exceedingly rare. After adjusting for multiple variables, including previous cannabis use and previous adolescent mental health symptoms, high THC content cannabis has been associated with an increase in anxiety disorder and psychotic symptoms. Cannabis use, particularly high THC content cannabis, has been linked to a worsening of schizophrenia. Patients who suffer from anxiety are advised to use CBD in conjunction with THC at all times, and to avoid high THC content cannabis. Patients who have exhibited psychotic symptoms, auditory or visual hallucinations, or those who have a history of schizophrenia or a strong family history of schizophrenia should abstain from the use of cannabis. Legalization and widespread use of medicinal cannabis has highlighted a new syndrome of abdominal discomfort and uncontrolled nausea and vomiting in chronic heavy users of high THC content cannabis. CHS, or cannabis hyperemesis syndrome, is separated from other syndromes of abdominal pain because it is relieved by the application of hot water, even after just a few minutes. Ceasing use of cannabis will also decrease or stop symptoms. CHS can be very serious because it can lead to a decrease in caloric intake with malnutrition or damage to the gastrointestinal tract from forceful vomiting. Overuse of cannabis can lead to a psychological and physical dependence, resulting in cannabis use disorder, CUD. 9% of chronic cannabis users will display symptoms of dependence with ceasing use. This can be compared to tobacco at 32%, cocaine at 17%, and alcohol at 15%. There are gender differences in withdrawal and addiction, with men more than twice as likely to become dependent. CUD has far-reaching effects, including the downregulation of the endocannabinoid system, which can have a negative impact on health and the body's ability to achieve homeostasis or balance. Symptoms of CUD include disruption in social function, cravings for cannabis, and withdrawal symptoms that can last 5 days, including restlessness, anxiety, insomnia, anger, or depression. There have been documented increases in drugged driving in areas where cannabis has been legalized for both recreational or medical use. This is complicated by the fact that there currently is no legal limit for THC in the blood, and that THC can take up to 30 days to dissipate from the urine. With that context, any chronic cannabis user will test positive for cannabis whether impaired currently or not. Cannabis can have effects on the unborn fetus and can be passed through the womb and through breast milk. Children exposed to cannabis in the womb have an increased risk of problems with attention, memory, and learning. Pregnancy and breastfeeding are absolute contraindications to cannabis usage. Unintentional ingestion and poisoning increase in areas where cannabis is legalized. This most often occurs in children and with edible formulations such as candies or chocolates. Accidental ingestion in children can be a medical emergency, leading to respiratory depression and even death. Cannabis must always be kept in child-proof containers, preferably a safe, when not in use and out of the reach of small children. Thank you for joining me in this discussion today about the side effects and adverse outcomes associated with high THC content cannabis in particular. I'm Dr. Darren C. McCauley, founder and Chief Executive Officer of Concierge Medical Cannabis.